Hey, how's it going?
Sir, are you okay?
What? Oh, this? It's probably nothing. I'm sure it'll go away.
Go away? But, sir, that can't be good.
No, it's cool. Really.
Do you want a napkin or something?
Everything's fine. Thanks.
You wouldn't ignore this. So why ignore the signs of a stroke? At the first warning signs, call 911 immediately. Because time lost is brain lost.
Hello and welcome to Road to Recovery. It's great to have you joining us for this program, a program that offers hope and help and healing and wholeness to those who are struggling with addiction, whatever form that may take. It is a privilege to have you joining us. We so appreciate those who have responded to these programs in the past, and we look forward to continue to provide individuals who can provide us with that hope and help that we need. We will be a better community when we all work together to address the areas of addiction. I'm your co-host, Steve Rao, and the other co-host is the Executive Director of the Recovery Center, Tricia Saunders. Welcome back to Road to Recovery.
Well, thank you.
It is always a privilege to talk to people, movers and shakers, in this whole addiction challenge. And we need qualified people, experienced people, people who have a history of effective leadership. And we've got one of those leaders with us today.
We sure do. Today with us is Orman Hall, who is from Fairfield County and has been a longtime mentor of mine. So it's an honor to have him back. But he is the current director of the Ohio Department in Alcohol, Drug, and Addiction Services. See, now I'm going to mess it up. Here, and for the state of Ohio, and we're thrilled to have you here today.
Happy to be here.
Thank you.
Yeah, it's a privilege to have you. ODATIS is kind of the term that's typically used.
ODATIS.
Yeah, and it's just a lot of letters and information in there. Thank you for coming and talking to us about your work at the state level. First of all, thank you for what you did for Fairfield County in providing leadership, especially in this area of opiate addiction, but all addictions as well. So thank you for your leadership right here in Fairfield County.
Thank you, Steve.
You were the director of the Alcohol, Drug Addicted Mental Health Board, did a wonderful job there. The governor, Kasich, made a wise decision when he asked Orman Hall to come to Columbus and help lead from the state level. How has that transition been for you now, some months old?
Well, you know, these last 2 years have been the best 10 years of my life.
Yeah.
No, it's been great. It's been really busy. It's certainly different than running a county program, but what an incredible honor to work with our governor, and he has a real passion for this issue. So it's been an exciting transition, and I've really appreciated every moment and every opportunity to make sure that everybody in our state has a clear understanding of what's at stake around opiate addiction and around addictions in general.
Well, I've read articles in the paper, seen things on television, and I know Orman Hall's involved because we've had the privilege off the air of talking a lot about these issues. You and I have gone to lunch together. I know, Tricia, you mentioned that Orman is a mentor of yours. Really, we can understand when something happens at the state level, it really came from our friend Orman Hall, didn't it?
Yes.
That's incredible work.
You.
It really is. Now, back in a year or two ago, there was a rumor that Fairfield County was the worst county in the country for addiction issues, especially opiate addiction. At your seat at the state level, you don't really find that to be the case, do you?
That's it's interesting. Obviously, when we were all here looking at the problem and we didn't have good data from what was going on around the state, it looked like we had insurmountable problems here that were more extreme than other communities. But looking at data now from a state perspective, Fairfield County certainly has a serious problem, but it is not anywhere near the most serious of problems from the standpoint of opiate and heroin addiction in our state.
How broad is that scope of opiate and heroin addiction, and really all addictions across the state of Ohio?
Well, let's kind of go back to the opiate addiction for a problem first. If you go back to 2001, about 7% of everyone in treatment with an ODATIS certified provider were there because they were addicted to either opiates or heroin.
7%.
7%. Now, if you flash forward to 2011, almost 29% of all persons in treatment for any addiction disorder are in treatment because they're addicted to either heroin or opiates.
Over
So,
4 times higher.
Yeah,
Right?
yeah. There's that from 7% to almost 29%.
Yeah.
That's how dramatic the overall change has been. And then there are a number of communities in Ohio, like Fairfield County, and I should have looked at our statistics here up to date. But in 2010, approaching 70%.
Yeah, we're still holding right around that pattern. So
about 70% of all persons in treatment at the recovery center are there because they're addicted to heroin or opiates. And again, we mentioned in the previous show, if you go back to 1999, which from my perspective wasn't all that long ago, there were only 4 people in Fairfield County that sought treatment for heroin or opiate addiction. So dramatic sea change in a number of ways in terms of the number of people who are addicted and who are seeking treatment.
Well, you have the privilege of looking over the entire state. You live here in Fairfield County, but you get to see the entire state. Are there sections of our state that may be struggling more than others?
Clearly, that is absolutely the case. And for the most part, those counties in southern Ohio, those counties that are adjacent to West Virginia and Kentucky, appear to have the most extreme problems. And to give you a sense, and I think we may have mentioned this statistic in the previous show too, if you look at Scioto County, which gets a lot of attention, in 2010, the 79,000 residents of Scioto County were prescribed 9.7 million doses of prescription opiates. That is 123 doses for every single human being that lives there. Just to the north of Scioto County is Jackson County, which actually has the highest rate of prescribed and dispensed opiates. So if you take the total number of doses there, divided it by their population, every single person would have received 133 doses.
Wow.
And what we know now is that there's a very close relationship between the number of prescription opiates that are dispensed and the amount of heroin that's in our state. There's about for those people that are statistically minded, there's about a 0.9 correlation between the number of doses of prescription opiates dispensed and the amount of heroin that is on our street or that has increased in time. So very close relationship between those two classes of drugs.
Well, you've said to me off the air that opiates and heroin are in essence the same thing.
They are the same drug. That is true.
I read recently where there is a bit of a shift in the opiate and heroin problem moving to the east. Are you seeing that at the state level to counties, say, over by Wheeling, West Virginia, and those kinds of things that aren't maybe as completely southern states or counties, like Scioto or Jackson or Athens County, but more to the east or southeast? Are you seeing that shift from your standpoint?
Well, clearly, the counties that have the most serious problems still appear to be in the southeastern part of our state. The poor, rural eastern counties also have very serious problems, maybe not quite as serious as those problems in southern Ohio.
Yes. Well, again, we would wish the problem to go away, but unfortunately, there are those who are still struggling. There's been some real advances, though, haven't there, Tricia?
There absolutely have, and I'd like to talk about what's happening. I know there's so much going on at the state level to help with this issue. What are some of the things on the forefront right now?
Well, it really kind of boils down to 3 things. And from an overall strategic standpoint, number one, we need to make sure that we use the right amount of prescription opiates in our healthcare system. So I'm going to hit these in a broad sense, and then we'll go back and talk more specifically. But we need to, number one, to make sure that we're starting to curtail the inappropriate use of prescription opiates in our healthcare system. That's number one. Number two, we need to improve the effectiveness of treatment. And number 3, we need to make sure that every Ohioan clearly understands how dangerous and addictive prescription opiates and heroin are. So going back to the first point in terms of curtailing the amount of opiates that are used in our healthcare system. In the spring, Governor Kasich signed introduced guidelines for physicians practicing in emergency departments. We believe very strongly that it's not appropriate to treat chronic pain with opiates in emergency departments. People need to be working with their local family doctors for medication, not emergency department doctors. Now, I'm not suggesting that if somebody has an acute pain situation, if they've broken a leg or if they've had an operation, that it's inappropriate to get narcotics. But we believe very strongly that it's important for physicians operating in emergency departments not to prescribe, unless it's absolutely necessary, narcotics for chronic pain. So that's one thing. The second thing is we're in the process of establishing a threshold for the use of prescription opiates in the treatment of chronic pain in family practice settings. That body of work should be complete here within the next couple of months. And what we know from other states that have done similar things, that once those things are in place, we believe that we're going to start to see a significant improvement in the amount and scope of how opiates are being used in our healthcare system.
Can you tell us where there's a dangerous dose level or
that's a great question. The literature suggests that people who are using at 60 milligrams or higher are at elevated risk for overdose and death. The state of Washington established not a hard limit, but a threshold at 100 milligrams. We're establishing a threshold around 80 milligrams, or we expect to establish a threshold where we expect doctors to be a lot more diligent about making sure that they're not dealing with someone who is either abusing their medication or diverting their medication. So about 80 milligrams is what we believe is a threshold or a dose level where physicians need to be concerned.
Okay. That's very helpful.
What's the future hold for this opiate and heroin addiction and other addictions across the state of Ohio as it relates to treatment, maybe new medications that are being developed and those kinds of things? What's the future hold?
That's a great question, Steve. And again, maybe going back to opiate addiction first. And opiate addiction at this point is the primary addiction that we're actually using medications for. And if you look at there are essentially three medications or three types of medication that we're using in the treatment of opiate addiction. The first one is methadone, which has been around for a long time. And that's a form of medication that I think a lot of people are concerned about. But for people who have long-term, deep-in, very serious opiate and heroin addiction problems, methadone may be the most effective approach. Methadone is what is called a full opiate agonist, but I've personally seen in a number of situations people being maintained on methadone in ways that allow them to get back to work and to fully engage in family life. So I think that methadone is a useful tool for some people that have very serious problems. The second form of medication is a class of drug called buprenorphine, also known as Suboxone, which is a partial opiate agonist, as opposed to methadone, which is a full opioid agonist. Buprenorphine, or Suboxone, has some rather unique properties. It has what's called a ceiling effect. So at 16 milligrams, buprenorphine stops having any kind of effect. So you can take 32 milligrams, 64 milligrams. It has no more effect than it did at 16 milligrams. The other thing that's rather unique about Suboxone, and we're probably getting a little technical here, but Suboxone blocks the effect of all other opiates. So someone can take a massive dose of heroin and it passes harmlessly through their body if they're blockaded with Suboxone. So it blocks cravings, and it blocks the effects of opioids, and it gives people an opportunity to engage in treatment. That is the second form of medication, and I think currently the most likely form of medication that someone would receive here in Fairfield County. And then the third form of medication is naltrexone, also known, or the most common version of that is Vivitrol, which is a long-release version of naltrexone. Naltrexone has no opiate effects, but it does block the effects of opiates. So those are the three classes of medication, and we're trying to work with all three of those types of medication, and they tend, not any one form of medication works for everybody, but one of those three forms of medication will work for most people that need and would like to use medication in their recovery.
We're very excited in our field to see the ability to treat people with more options, and that naltrexone is now becoming, a more a possibility for all of us, because you've helped get insurance companies paneled and all of that to provide it. So we're very thankful for that.
A lot of work to do. There's a lot of stigma around medication for opioid addiction, but what we know in general is that the relapse rate for opiate or opioid addiction may approach 90% without medication. Now, that's not to say that there aren't some people out there who have recovered and are recovering without medication, but we think it's important and it needs to be available for those people that choose to use it.
Very good. We are out of time, but it is such.
Did that happen?
I know you're just a wealth of information. The state of Ohio is a big state, so there's a lot of work that needs to be done. Tricia Saunders, you got to feel comfortable that Orman Hall is at the helm, and the future looks very bright for those who are struggling with addiction challenges.
And I think he's even working on gambling addiction now. So who knows what might be down the road.
How about
next time?
Exactly. Maybe we can have him back and talk about that challenge. Orman Hall, Director of ODATA, State of Ohio, we so appreciate the work that you do. Started here in Fairfield County, moving to the state level. We encourage you to keep up the good work, and thank you for what you're doing.
Thanks, Steve.
Thank you for joining us for this Road to Recovery program. If you are going through a challenge of addiction, or you have a family member or friend or coworker who has an addiction challenge, give Tricia Saunders and her staff and volunteers a call at the Recovery Center, 740-687-4500. There are people there who are knowledgeable, experienced, qualified to help you through this journey. That's 740-687-4500. Join us next time as we continue further down the road to recovery.
I didn't need help from anybody. I was good at everything. And this, the drugs and the alcohol, I couldn't stop doing it. I went down a path of destruction. It was just about escaping the feelings. I never used one without the other. It was chaos. A dump truck, insanity plowed into us. I know it was the devil. I actually got suspended from baseball. I said, I need help, but I can't do it anymore. I fell on my own. You do with me what you want to do with me, but I surrender.